Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Ectopic ureteral orifice. Ectopic ureteral orifice, it is 80% of the cases, it is associated with duplication collecting system. In duplication collecting system or double ureters, the upper pole ureter will mostly get inserted medially and caudally when compared to the lower pole ureter. So this upper pole ureter is said to have an ectopic ureteral orifice, whereas lower pole ureter will go and it get inserted into the normal ureteric orifice. So this ectopic ureteric orifice is most commonly seen in females. Then the location. If there is ectopic ureteric orifice, this opening of ectopic ureteric orifice, it is mainly opens into the prostatic urethra or posterior urethra if in males. Thus this opening is mainly lateral to the bladder. And if the ectopic ureteric orifice opening is seen in the females, the ectopic ureteral orifice is seen anterior is seen in the anterior urethra more commonly, or it can be seen in the vestibule or vagina. So if you see the location in the males, the ureteric location, the ectopic ureteral orifice in the males is present in the prostatic or posterior urethra. So this is the bladder, this is the urethra. Here we will see this is the prostate. So this is prostatic or posterior urethra. So the ectopic ureteric orifice will come and it will get inserted into the prostatic urethra, whereas if you see the same thing in the females, it gets inserted into the anterior urethra most commonly, or it can get inserted into the vestibule or vagina. So if you see the clinical features, okay, in ectopic ureter, if there is, we will see clinical features in next.
thank you and thank you for watching.